Plastic surgery is actually not just about vanity.
First myth is people think that, weight loss, let's go. So that you got to turn them down.
Guys, it's all in nutrition, it's all how you take care of yourself. You will never look the same how you used to look 20 years ago. That's what people don't understand.
True. People are not accepting that women can age.
I don't know what is it with nose, but like you said, I think it's number one plastic surgery when it comes to the face.
Everyone's idea of desirable is different. So
Joining me today is Dr. Sandeep Sharma, a board-certified plastic surgeon with over 26 years of experience, the founder of AESTHETIQUE, which is a cosmetic and plastic surgery center in Baroda, as a surgeon who has performed more than 10,000 procedures worldwide. Dr. Sharma was also the president of the Indian Association of Aesthetic Plastic Surgeons in India, placing him at the forefront of setting ethical standards, safety protocols, and best practices for aesthetic medicine, not just in India, but on international platform. Dr. Sharma, thank you for being here.
thank you, Nelly, for the kind invitation. It has been a pleasure being here.
Thank you. What originally drew you to plastic surgery as a doctor?
Well, I think a couple of things. Number one, my father was a plastic surgeon as well. So I probably grew up in a plastic surgery household, so to say. Not that he discussed much about his work. He did show some, pictures about his work and all, but they were subtle. And but what drew me is his attention to detail, his attention to hygiene, his wanting to kind of finish things as they were. So those things I think grew on me, and I think those are the inherent qualities of a plastic surgeon. So that's sort of the initial part, which I think subconsciously sort of pushed me in that direction. And, I had this liking for plastic surgery. And again, doing the same things with a more finesse is what's cosmetic surgery. So cosmetic surgery is a subset of plastic surgery where kind of you're dealing with sort of normal issues to make them better. So that's what I think's been my journey.
That's amazing. That's absolutely beautiful what you do. Do you think that only insecure or weak people choose surgery?
Well, actually, Nelly, I would say it's absolutely the opposite. I find that number one, getting surgery is not your everyone's cup of tea. It's not like just walking into the park. So people really think long and hard before they even consider surgery. So before they come to a doctor's chamber or a surgeon's chamber, especially, they are really focused on that. So I find that these women are more driven, they are more focused, they know what they want.
But I think still, even in today's world, I think women are so harshly judged for opting for cosmetic surgeries. They think of it's just vanity, or she just wants attention, or she's so insecure. And especially in India, I think that's the case. When people get cosmetic surgeries done, it's a secret. Like nobody should know about it. So what is your take on that? And do you think it's different from the West?
Oh, yeah. It's, there's a lot of truths and as well as, myths in what you've said. As far as being judged harshly, that's absolutely right. You framed it quite right, that they are quite harshly judged. As to vanity, not at all. Actually, not really, not at all is what I would say. Most women who want are more determined. They have an agenda. They have a focus of what they want to be. And because they can't get there, they kind of take the, put their hands on for surgery to kind of get to their goals. And as to vanity, the other reason I would say no is because, especially in India, people are very goal-oriented as well as focused on outcomes as to the benefits. So they would not just go in for a procedure for the sake of it or for feel good. There is usually a reason why they want it.
Okay.
It may be fitness, it may be a relationship, it may be job-oriented. So there is always a defined benefit when they do it. So if there is a benefit involved, then it's not necessarily only cosmetic, which basically means in a way frivolous or just by the way. So it's not really that. So yeah, in that sense, and comparing it to the West, well, there is more from what my colleagues tell me when I attend meetings, and also when I've lived overseas, I see there the thing about doing it for doing its sake is more. So that's the difference.
People say that when you get a plastic surgery, it's just so obvious and sometimes it just looks fake. So what do you have to say about that?
Yeah, true. I mean, if that's what happens after surgery, then it's actually not been a good outcome. The whole idea about plastic surgery is that the surgery gets you back into society integrated as normal. So anything which is abnormal, is not a good outcome. So
Okay.
it should not really be fake. It should be subtle. It should, and most women who come, or most people who come, men and women, the first thing they say is, "Doc, please make sure that nobody notices it." So basically, they want a noticeable change, but not to draw attention. So it's basically that's what my goal is, to give an outcome which does not, become obvious that a procedure was done.
Okay. So, Dr. Sandeep, you with so much of international experience in plastic surgery, and you also, as I know, used to be the president of Indian Association of Aesthetic Plastic Surgeons in India, right? So, what do you think? How do you rate Indian surgeons as compared to the West?
Yeah, well, it's very difficult to judge yourself, because when I say my society is me myself, so it's like I'm blowing your own trumpet if you say. But yes, when I see the outcomes, I see the transparency with which my younger colleagues discuss. We have come a long way and integrating the principles of aesthetic surgery, and we are really sort of, especially in a few procedures, especially like the nose, the hair transplant, body shaping, we are at par with the best.
Okay.
Yeah, and we do go and present our work globally, and it gets well recognized. We do get guests from overseas to our meetings, and their appreciation tells us a lot that we have actually arrived on the aesthetic scene.
Okay, great. But do you still feel the stigma amongst people in India? I mean, that Indian plastic surgeons are not as experienced or not as qualified as the doctors that they could meet abroad. Does that exist? Like in your
No, I don't think that exists
doesn't
anymore.
exist. Okay.
Yeah. We do get people who feel that they are too entitled and that they want to go to the best, and the best is only the West. So but that's something time will correct. But I think that's also got to do with social status and their need for confidentiality.
I see.
Yeah. So.
Okay, great. There's also one myth that once you start getting into plastic surgery, you just get addicted and you never stop. Like you get one procedure after another after another. Is that true?
Yeah, well, I wish that was true, but that would be my retirement plan then. Yeah, but the thing is, with some procedures, yes, and but majority people come with a problem, it's sorted and they're done with, and especially in India, that is definitely the case, because the proof in the pudding for me is that many times when my staff reach out to some people, you can get the message that they're done, so they moved on with their life. So yes, it is not really a recurring thing, unless there's a problem which you're only done half a fix, so you need to kind of top it up.
Okay,
Kind of
okay.
thing, yeah.
So how risky it is to actually get a plastic surgery done? What are the risks?
True. I mean, that is the most valid question which everyone or every one of your listeners, if they ever go to consult a plastic surgeon, should ask. And the answer to that is it depends upon a few factors. And number one is the gamut of the problem you have. Is it a big problem or is it a small problem? Right? Secondly, how fit are you? I'm the same procedure if I do it on a fit young person versus somebody who's a bit older, is diabetic, has blood pressure issues or heart issues, the risks compound that much more. And the third thing is the quality of the setup. We get all these bad news in the newspaper, so-and-so person had this mishap, had died, whatever. Recently somebody had died in getting a hair transplant done. You find out that it was being done in a hair salon.
Wow.
I mean, see, if you take those kind of risks, then such outcomes are explainable. So it gives the procedure a bad name, but it's actually the setup which was wrong. Then there are unqualified people doing it. Recently in Agra, the similar thing happened, and turned out that it was a dentist doing a hair transplant. What does a dentist have to do with hair? I mean,
It's
so you
a
tell
very
me.
profitable business. I think that's why
That's true.
everybody.
Yeah. So then, if you're going to be in the meat in the pie, then that's what
Yeah.
happens. So you got to be clear about what you're getting into.
Okay.
And so basically, it's a setup, it's the qualification, it's your own health, and what procedure you're getting it done. As I said recently, I did a big procedure, so I obviously do all the tests. I have a qualified anesthetist, and we do it, and we explain what you're getting into. There's a recovery period, and you're fine.
Okay, I see. So I'm from Russia, and in my experience, at least where I come from, I feel the difference is such that women in Russia are more concerned about how they look, and they pay more attention. You know, that's absolutely there. So in that society, I feel like, especially once you become a mother, you know, to go for a certain procedure is like a very common thing. You know, and we also have like a lot of bloggers there who openly show and talk about how certain procedures are done, because it's not exactly shameful, you know, there. But here, I feel it's still like it's a bit of a taboo or a secret. I feel especially if you look like at Bollywood celebrities who undergo certain procedures, and then people notice that, you know, and they get harshly trolled basically for, oh, she got a boob job, or oh, she got a nose job, you know, she looks completely different. Or, you know, you look at, I don't know, Katrina Kaif, how she got Botox or whatever procedures done. The whole internet was just so upset with her and like, oh, she looks like this now, and she completely ruined her face or whatever. But, you know, these are like the same people who will troll her for not getting stuff done. They will be the same people who will be saying, oh, she got so old, she looks so bad, or her nose is too big, or whatever that is. You know, so that's, I think, the paradox of being a public person and getting stuff done, you know, to your face. Of course, it's a part of the job, and I think not a lot of people understand that, you know. But yeah, I hope this shift happens like you have mentioned, right? So there is a certain shift that is there now, that people accept it.
There is a shift, and it's more to do with social media. So social media has really got you know, cameras into everybody's drawing room, if not bedrooms. So that basically, you know, puts a subconscious pressure as well as a conscious desire to kind of get these things done. And so you know, world follows you know, want or requirements follows supply, right? So as there's more need, more requirement, you know, there's better supply. So we have more doctors who are skilled. I was the president of our national society. We sort of made it a point to kind of get more and more people involved in structured training for aesthetic surgery, so that we could get better results. There are more people available to kind of service society, so there are better outcomes. So it's sort of two sides of the coin. So yeah, India is lagging behind in that sense. I would not call it lagging behind. It's sort of getting aware. We were traditionally a joint society. So, you know, when you grow up in a joint society, you tend to keep to yourself. So as a matter of mindset, you tend to not kind of put everything on the table, right? Even if it's your own dining table. So, and that mindset sort of continues. So people do not come out with their problems. They do not come out with the solutions. So that sort of, to me, seems to be the reason why people don't share what they go through. And as with anything in life, if you do not sort of hide something and it comes out, it sort of seems like coming out of the Pandora's box. So it's more liable to be controversial. So, and if you're a celebrity where sort of, you know, you do something, if you don't tell it out in the open, you're actually creating that, you know, mystery or, you know, given to comments. The point you made about, you know, Katrina Kaif or any other actor for that matter who's trolled, there are two aspects to it. One is the fact that why did they do it? And the second is whether it was a good enough job or not. Right? So as you know, every man in India is entitled to have his own favorite heroine, right? Same way they have a right to kind of feel what they think is good. And so that's, I think, is also because it's quite a different discussion, which we shall dwell into at some point in our chat today, is right and wrong. You know, whether it's you're done with the right person, the person is well, you know,
aesthetic enough
or not, or even qualified enough. You see, the only big problem with India, we've got so much population, we've got so many good, you know, artists in every field, but law, enforcement of law, as well as ethics are not necessarily followed. So we have so many people who are sort of famous, but not necessarily qualified. So that's also which creates what we call as, you know, unwanted or unacceptable results. So that's probably also a reason of trolling.
I see. And also I think that people compare, especially for people who are in front of the camera their whole life, let's say Katrina Kaif, I'm just using her as an example. I love her as an actress, and I think she looks absolutely beautiful, you know, when she started career or even now. But people compare her to like, okay, what she was, let's say, when she just started her career and what she looks like right now. And of course, we all change. We all age. It's a completely normal, it's just a
Process.
way of life, and it's a beautiful thing also, right? But then people compare what she used to look like then to what she used to look like now. And of course, and then let's say you do certain procedures to maintain yourself, and you will never look the same how you used to look 20 years ago. That's what people
True.
don't understand.
True.
So it's either going to be a naturally aged version of you that never, done any procedures, or a sort of improved version of the aged you. I think there is like a slight difference that people may not understand,
I think what you're
Yeah.
probably hinting at is people are not accepting that women can age.
Yeah,
Men can, but women
actually.
can't. So your
Yeah.
sweetheart has to be the same.
And aging being the main concern for women, the whole cosmetic industry, the beauty industry is just like it's based on aging, actually. It is actually, I think, based on aging, right? Primarily. And I want to understand the differences of how, let's say, women in India age versus like Caucasian skin. How the differences of aging, how we should approach it differently, maybe.
Yeah, so there is a significant difference in the two. Caucasian skin basically, is at its best in the early parts of life, in the first 3 decades, and it is not given to, handle abuse very well. So too much of sunlight, to not care because it's finer skin, it kind of tends to either get wrinkly quicker, it gets sun damage quicker, it sags quicker. So as opposed to Indian skin where sort of, you kind of, you see women in their 40s, 50s, they kind of do maintain their radiance. They still
A lot of
don't
people
have...
in India who, without any treatments, there are no wrinkles. You look
Absolutely.
at them, auntie, how do you look so well?
Correct. So that's sort of cultural
Yeah,
genetics, if you
that's
like,
there, yeah.
which sort of does the trick. So that is a difference. But unfortunately, in the last few decades, and there has been a shift in the quality of Indian skin as well. I get, if I had the sort of good fortune of having, a granddaughter, a mother, and a grandmother come in 3 generations, quite often the grandmother's skin is the best.
Oh,
Yeah, which should be actually
even
the other way
I've
around.
observed that sometimes with people. It's just
and,
there.
And which is a shame because, you're just sort of negatively messing with your, gifts which you have, which nature's given you. So, and I attribute that to sort of poor quality of nutrition, well, that's another discussion, yeah.
Yeah, but that's interesting. So you were saying basically the reason for the change, how today's generation is aging faster here in India. So the reason would be nutrition?
Not aging, damage.
Damage, oh sorry.
Yeah.
Damage.
So skin damage, body damage is because of, when I say nutrition, as in what nourishes our our body is basically, air, water, and food. So air pollution, poor quality water, and adulterated food. So it may be poor choice of food, like you're having fried foods, fast foods, packaged foods, or it may be good food, but it's sort of not grown correctly with so much of fertilizers, pesticides. So there's so much of chemical in our digestive system, and you see food's nutrition. And so if you don't get the right nutrition, no sort of body can perform perfectly to its optimal, and that's where the damage is. Whenever you're getting suboptimal nutrition, the first organ in the body which kind of gets disadvantaged is the skin. And subsequently you get damage to the internal organs like liver and kidney and all that stuff. But so that's why you get young kids who are coming with dull skin. They get pigmentation problems, and that's a lot.
Okay.
A lot
So
of them.
what would you recommend actually to reduce the damage, to skin and to overall your health?
I think it requires a paradigm shift in our society vis-a-vis nutrition, as in you have to, every mother, because she's the nutritionist of the family, so she should actually have a degree in nutrition to be able to take responsibility for 2 or 3 or 4 members in her family who kind of blindly put in their mouth whatever she puts on the dining table. So, so the food should be right, and the cooking method should be right, and also the source of food should be right. So, I mean, in the ideal world, everybody be eating organic foods, which may be a pipe dream, but whoever can afford it, has a small terrace or has a perhaps small lawn should grow their own food. And that's the only way in the immediate future for us to kind of keep ourselves healthy and disease free.
Amazing. I'm loving that plastic surgeon with so many years of experience is telling us, guys, it's all in nutrition. It's all how you take care of yourself. And it all starts with the basics. I actually believe that
That's
too.
correct. Yeah.
Yes. And what would you say about pollution? How badly does it actually, damage our skin?
Significantly.
Yeah.
There is a direct impact of pollution on your skin. That's a no-brainer. With people on two-wheelers, with so much of exhaust fumes, which they have to kind of weather, it's obviously going to cause damage. The sun damage, your outdoors also does cause damage. The foods which you take increases the sensitivity because your skin is no longer that healthy. It's more given to easier damage from the sun than otherwise from a healthier person. Plus, you inhale these fumes, so your lung capacity is poor, your oxygenation is poor, so your handling of infections, your handling of pollutants is also poorer. So at every level, you're sort of being, compromised.
I love Mumbai, but I think listening to this, I might consider relocating.
I think this is more something a call to action for the administrators, to keep Mumbai alive, in the health sense.
Yeah, and AQI here wasn't always that bad, actually, right? It significantly, worsens, but
that's correct.
Maybe 10 years ago when I just moved here, I remember the air just felt a little more clear.
It was 199 today, so it's sort of scary.
I know. And I feel like, it's all right for us adults who take this responsibility that, okay, I have to live here and I have to chase my dreams and all of that. That's why we all are here, right?
That's right.
But at the same time, as a mother myself, I feel that immense guilt, for my children. It's not their choice, to live here, to be born here. And it's something that I think every parent living in a big city in India, like be it Mumbai or Delhi, faces, that pressure and that guilt, what kind of air I'm letting my children breathe. And it's something, I guess, to think about and
True. You have to kind of, do what you have to do and optimize, your benefits in that situation. So you'll have to probably look at how you can minimize the damage rather than just, because not everybody can relocate, right? And you don't want to because there's another damage if you relocate.
Okay.
So, yeah.
That's there, right. Okay, doctor. And first of all, that completely, honestly, shifts our conversation, from, okay, it actually all starts from within and we should address, nutrition and pollution levels and where we live overall. But with your experience of more than 26 years, in plastic surgery, and I know that you have also practiced abroad, like in Melbourne, Australia, if I'm correct, right? So what do you think are the differences, the key differences of, practicing surgery abroad versus here, maybe within your patients, with requirements and overall medical practice?
Yeah, when we talk about the different countries, if I'm talking about cases, yes, in the West, people were more concerned about the face and the look. So I had more cases for rhinoplasty, what you call as nose job, or eyelids, which are signs of aging, or a facelift with the wrinkles. Indians are more given to not addressing much on that. So they would rather have something which is a relative non-surgical option to do it. But again, that's changing with social media and with times. On looking at other procedures, like for body shaping procedures, we Indians don't tend to, as we were talking about nutrition, look after ourselves that well. So there is a lot of hormonal changes as well, which tend to de-shape our body. So correction is more mandated in Indians than overseas. So that's sort of a bit of a difference which I did. As to a mindset, they are more given to address and solve a problem quicker than sit on it, have a discussion with the husband or the wider family or with friends and then make a collective decision. While there, people tend to be more focused on decisions. They want to do it, they'll go ahead and do it and get it over with. So that's sort of been the difference I find between the two cultures. But yes, acceptability is getting better in India.
And speaking of like, also medical tourism, I know that a lot of people who plan on certain procedures, they pick on a certain place based on, okay, I can also have a bit of a vacation there, and like also they feel that, okay, doctors there are more, like they're just better at their job there. Like a lot of people travel, let's say, to South Korea, for skin procedures because South Korea is known to be, a pioneer, in that field. And a lot of people also travel to Dubai, for their safety and the surgeons who work there. Where do you think, in your experience, is the most popular destination for medical tourism?
Yeah, well, medical tourism is here to stay, and people do it for multiple reasons. The commonest I find is for finance reasons. The number two reason they want to do it is they want to go to an expert. As you said about South Korea, which is sort of very big on facial, minimal surgical or non-surgical procedures, and they're pioneers. You rightly said that. So that's would be an option. And the third is when they can get, more bang for their buck. So, it's okay, from the cold winter of Europe, you come to Asia and, you also have a warm, sunny vacation and you also have a procedure. And so you get the best of both, as well as the weather, the holiday, and the financial saving. So that's sort of what decides. Personally, I have a fair number of NRIs who come. Almost 30% of my major procedures are patients are NRIs. So I'm pretty familiar with what it is. And yes, they tend to be more open about what they get done because though they're Indians now, they live overseas. So their approach is quite more Western than the locals. So they are more given to go and tell, oh, I got this done and whatever. So you kind of get more people following up from there. So that's sort of good how they sort of interact. As to expertise, it's a pretty much individual thing. You get excellent doctors all around the world. Same with India. You can have the other end of the spectrum as well. So it's a sort of selection process that you'd want to do, how you decide to do it.
I see. After living over 10 years myself in India, I trust Indian doctors the most. Right. That's the truth. If I ever if I have to relocate ever in the future, I would be like, okay, first I need to get this and this and this done here in India while I'm here. I would go to my dentist. I would go to see my, my doctor. And because, okay, there is trust. Of course, there are certain connections that you grow over the time. And overall, I found Indian doctors to be very professional and very to the point, and they, in my experience, they don't push you, to certain procedures that you may not need. And that's, I think, very commendable and very, rare.
Yeah, thanks for that. I've heard that a lot, and I've never applied mine to kind of get to the bottom of the psyche on that. But yes, what they tend to say is that, yes, we were heard, and what we said mattered.
Indian doctors really listen, right. I swear. Even okay, I have kids and I have to take them to pediatrician. Usually the lines there are quite long simply because a pediatrician is very patient. He will sit and actually listen to the mother and all of her problems and all of her family drama and all of, which is also important, postpartum. You have so many, questions.
That's how you get to a diagnosis quite often.
Pediatricians' work, I think, okay, maybe 10% is actually, addressing the child's needs. 90% is the mother. So that is something that I really appreciate in Indian doctors here.
Right.
Plastic surgery is actually not just about vanity. That is something that a lot of people, I think, don't know. So if you could tell me, give me some examples where it's actually not about vanity, and what are your most common, let's say, cases and the patients that you usually work with?
Yeah, well, interesting things which stick to mind are I do a lot of body shaping procedures, which is basically, you may say, if you're looking at the tummy, you do tummy tuck, or you do a liposuction, liposculpture of the thighs or of the love handles, the back, the front, to get to shape. Basically, these are fit people's procedures. So it's not for a weight loss. It's for basically, if you are a fit person and there's certain areas of the body which do not, get to the shape you want, you hit the gym, you've done your bit about proper nutrition,
I can relate
exercise,
to that.
and then so that's when our role comes in. So the first myth is people think that, weight loss, let's go. So that you got to turn them down. Go and get fit. If it doesn't work, then come to me. So give them an year or two to at least work on themselves. So I had this young girl. She used to play for the Baroda cricket team, and she had she was very fit but a bit stocky, and she when she ran, her thighs, which were relatively big, rubbed. So I kind of shaped her thighs, removing the fat through liposuction, so that the thighs became slimmer. So now, because with slimmer thighs, she could run faster. So her running between the wickets, as a batswoman, became more efficient.
And also removes the discomfort, I guess.
Yeah,
right,
absolutely,
of
absolutely.
the-
So hygienically better, functionally better, and here in this case, because she's a sportswoman, better outcomes.
Wow.
And so that was good. So she was very happy. And then once she came back and she was really upset. I said, "What happened?" She said, "You know what? The coach is taking all the credit, saying, 'See how I trained her? She can run faster now.'" So yeah, so there's sort of always many times a deeper angles of things. So you're talking of that. There's also a couple of gym owners who runs women's gym. They come and get body shaping done from me, and then they say, this is my gym outcome.
Okay.
So not always what meets the eye is what you see. Yeah, but going on a more serious side, most women after pregnancy, if they do not start looking after them right away, do end up with a bit of loose skin around the belly, and or more a bit of fat also around. It doesn't help that hormonal changes at that time do also tend to shift fat. So fat gets deposited in the wrong areas, which sort of it doesn't feel good. So again, if after a period of diet and exercise doesn't help, it requires some kind of intervention to get a person back into shape, like what we would call the pre-pregnancy state. Now, I would only consider a person if she has worked on herself, and I know that she's going to maintain herself. Because anything which you don't maintain is going to go back to square one. And so those are sort of the people who I look after, and I get, very satisfied ladies.
I see. I mean, I myself, as a mother of two, actually, I have faced all these different changes in my body. So I had my first one when I was 22, just relatively very young. So because I was so young, my body adapted quickly. So I've lost the weight also quickly, even though I've gained a lot of weight. I've gained 25 kgs in my first pregnancy. So there was a lot of work to be done. But I was so young, my metabolism was also much better at that time, and I was a very active mother as well. The weight just, was gone, and I was actually thinner and more fit than I was before pregnancy.
Right.
That's what kids do to you, okay? With the second kid, with my second pregnancy, of course, it wasn't that easy. I was already 27, 28. The metabolism isn't as good as it used to be, and overall, the recovery time wasn't as quick, let's say, right? And I'm relatively a fit person. I would say I work out, I also do yoga, and I have noticed that no matter, even if I really work on my abs and I work overall on my body shape, there's still loose skin. And of course, like how you rightfully said, the hormones affect how your body stores fat. That's what a lot of women don't understand. But what is even more, I think, crazy about this is that after delivering, after having kids, we often don't check ourselves for diastasis recti. That is something that I would love to talk about to all the women out there, because I think it's very, very important. Because what happens, a lot of us get diastasis recti. So what it is basically, it's basically a separation of your abdominal muscles. It could be as small as just one finger, 2, 3, sometimes it's a full fist, and that's a dangerous one. And a lot of people, like a lot of women, they don't even realize that they have that, but it's very important to check. Because what happens is, let's say you have that and you're unaware of that, and the first thing you do is you go to the gym in attempt to lose weight or get your abs or whatever, and you're unaware of this problem. So it will actually worsen the condition, leading to a lot of issues. And the least that can happen is just a lower back pain, which will actually be there if you have diastasis recti easy for the rest of your life probably, right? But what's even more concerning is I think you can get a lot of conditions like chronic pelvic pain, right? You can get hernias, basically how you rightfully explained your intestine is, attached to your spine and could just
Yeah, flop
bulge.
forward. Yeah,
Yeah,
correct.
and a lot of women are thinking, oh, why do I have this? Like my mommy pouch doesn't go, and they think it's just because they're not eating right or something like that. But the issue could be so much deeper, and it's a medical concern. Like it's not just vanity, and it doesn't just go with the time, it doesn't just go with the gym. It actually gets worse with your crunches, as far as I know. And I think there should be more specialists, who address that. Right?
True. Yeah. Well, you actually kind of passed the buck on to us, but I think you're right. We as a society should actually try and increase awareness about diastasis recti. And recti is a sort of two muscles which are like
Yeah.
straps on the front of our tummy. And they sort of, if they are apart, they are sort of technically a hernia. So and if it gets worse, it starts bulging out. That's when we call it a hernia. So it's like a pre-hernia state, and that sort of should be corrected. And yes, that will affect our posture or a lady's posture because the intestines are sort of in a way hung from the spine. So when there is a bulge in front or there's a gap in front, they kind of tend to flop forward and they pull the back. So you always get a curve on the lower back in such ladies, which is called lumbar lordosis. And so it's this posture change which leads to backache. And in some people who are heavier, it can be worse. Over a 20-year period, they start having spine problems and then they have a disc issue. And so the problem started post-pregnancy, but it was neglected out of not wanting to do
Imagine
something.
all of that, and you're picking up a baby continuously.
correct.
How many times through the day?
That's correct.
How
Yeah,
crazy is
correct.
that?
So exercise is mandatory initially because it might make a difference. It does in the ones, as you said, who've got only one or two fingers. That it can make a difference, but anything more, it can work against you.
Like the
And
right
so-
kind of exercise with the specialist, because if you just go to the gym and that person is just unaware, he'll make you do the crunches. You
True.
make it worse,
That's
actually, because
correct.
it hardens the...
Right. The other thing about this is, one is the backache and the disc issues. The other thing is also related knee issues. Now you'll wonder what's the knee got to do with the belly? Yeah, well, actually, what happens if you've got a belly hanging in front, and so the center of gravity shifts from the center to the forward part. So the weight of your body falls more on the front of your knee than on the back. So sort of as you walk over a period of time, there's more wear and tear on the front aspect of your knee than the back, and that's what sort of leads to a differential wear and tear and causes knee issues. So so it's basically posture which needs to be corrected. Do it surgically, non-surgically, that's a separate issue, but yes, that needs to be corrected. And
So for diastasis recti, if somebody has that issue and they want to correct it surgically, so what is the procedure for that?
well, I would be correcting whenever I do a tummy tuck. That's what I would be correcting. Because you need to get the muscle together only to get a flat belly. And the flat belly is not vanity, it is just pushing your intestines back in, right? So you're not just sort of shifting them from a huge space to a smaller space. And so you are actually sort of recreating anatomy. So which is the right thing. It's not the wrong thing, it's the right thing to do. So you do a tummy tuck where you kind of correct that, and in the process also take out the excess skin below the belly button area, which is usually where the stretch marks and poor quality skin is there. So that sort of takes care of both.
Okay. I've actually heard that in some hospitals, doctors offer that if you're getting a cesarean, they will also do a tummy tuck at the same time. What do you think about it?
I would be totally against that.
Okay.
I don't think it is the right thing to do.
Okay.
So you're subjecting, on a physiological procedure, a second procedure, and also secondly, you really don't know what is required because a lot of it's going to shrink on its own. So it's pretty much like when people come to me, as I was telling you earlier, they say, oh, they just want to lose weight. I tell them, no, hit the gym or, get yourself fit and come back, because a lot of it will take care of it naturally. So our job is to only fix what nature cannot.
Okay.
Right? So we don't want to kind of compete with nature and do what nature would do it anyway. So as we know, many ladies do not require anything doing after pregnancy. There is a number which does. That's the one we should address. So it's well worth the wait, I think.
Amazing, amazing. Because I was considering that. I was thinking, oh my God, how convenient it is.
No, it
But at the
sounds
same
convenient.
time, you know, like this first hours when the baby is born, it should be about that. But someone who has
Absolutely.
experienced that, you know, when they just place the baby on your chest, it's the best feeling, you know, you just want to be with him and not be in the surgery, you know.
No, that's true. But from a surgeon's perspective, also, you're not able to do the best job. Because you
Okay,
really
like
don't
that.
know the degree of problem, right?
Actually.
I don't know how much you're going to shrink,
Yeah.
I mean, how much a person's skin's going to shrink, how much of a diastasis is going to be. So why would you want to sort of, how do you judge?
Okay.
So I would be totally against that.
I see, I see. So in the world of plastic surgery and cosmetic procedures, please tell us what are some new innovations maybe there, because like how you rightfully said, there are some now procedures that are non-surgical, so they're non-invasive, maybe for the facelift or something that you no longer need to actually, you know, cut the skin or do the facelift in that way. So what is available
See, it's a mix of technology and technique which has progressed significantly. So we've just got better because we are doing more of it. People's awareness is more. People's expectations are higher. So we have to kind of deliver better. So that sort of improved our standards as well, and the numbers have increased. So our experience has also increased.
Okay.
So literally going from head to toe, we do hair transplant as a routine, and now good outcomes are a given. So it's just a question of selecting the right candidate. So you do it for the face as well. There are many non-surgical options to kind of rejuvenate your face. Initially, in my early years of training, you only had surgery, otherwise you couldn't help. But now you've got so many other ways of doing it, taking care of wrinkles, taking care of hollowing of the face. You have injectables, which are called fillers. You can, improve your skin quality. You can hydrate your skin, so to make it much better. You can tighten your skin. There are sort of radio frequency machines which can do it. There are sort of threads which can do it. So, and there are lasers which can resurface the skin to make it better. So all in all, a lot of technology and also technique. When I do body sculpting, now I can mix procedures and do it. Recently I did a hysterectomy along with the lower body recontouring, which involved the tummy and the love handles and the back. So all of that we can do together, which we had to do in stage procedures in the past. So things have sort of moved on. But the key is to know what a person needs. What goes wrong and gives things a bad name is when they talk about things not going right. That's basically because it was done on the wrong person, or it was done by a person who was not qualified to do that. And so
or sometimes maybe patients are so sure in their head that this is how I want it, and they're being too maybe sometimes stubborn to see that it's not exactly maybe what they need.
True. Yeah,
Like
and that's what brings
there.
us to the comments we made about Bollywood stars. Yeah, a lot of times I am sure no doctor wants his or her
Bad work
person to be looking not very desirable,
course.
but everyone's idea of desirable is different. So you get sucked into agreeing with your patient all the time, because it takes a certain mindset to be able to say no. You see, I kind of many times, almost sort of 20% people have to tell them, no, sorry, this is not doable.
Okay.
Yeah, and I would not do it. But then I suppose it would be a different ball game if you had somebody who has an overpowering personality, right? so that can be challenging. So yeah.
I also see that the concept of beauty, like how a person sees themselves, could really impact what kind of procedures they want. Like, let's say somebody is insecure about their nose since the time they were born, okay? Maybe somebody passed a comment, or your nose is big, or whatever. So it got stuck in your head, and you sort of, it's subconsciously, it's at the back of your mind. I have a big nose, so my nose has some kind of a, it's my flaw, okay? So you focus on that. So whenever you see, let's say, a picture of yourself, you only focus on your nose. Subconsciously, it just happens. So let's say you got your pictures done, and a photographer would choose a picture of you where you look your most beautiful according to his professional experience, But because you are so conscious about your nose, you'll only choose a picture where your nose is less visible. And it's just how humans, subconscious works.
True.
And I think this is where the ethics come in place, and this is where a certain level of maturity has to be there. Because I remember, like, when I was 18 years old, so my biggest complex were my eyes. I felt like, okay, my eyelids are that's still 10 years ago, imagine that. So I felt like, okay, I really need that, what is that called? Blepharoplasty. Yes, so I really considered that because I was, okay, I look too different from others. I want to look like others.
Right.
And, and at before the age of 25, before your frontal, cortex is developed, you should not make such decisions.
Correct.
And thank God I did not, because like 10 years after, I'm like, I love how I look, and thank God I did not do that. Right. And if I ever do that, that'll be at the age where, like, okay, maybe I want to just look younger, when it's like
True.
a different kind of an issue, But my God, thank God. At the age of 18, where you're just still developing, you could be insecure about anything. Like, I was insecure about my eyes or my nose. And if I had an opportunity to change that, I would have. And what a tragedy, you still didn't get to know yourself, you still didn't get to see the beauty in yourself.
Correct.
And that's where I think, even my experience in modeling was like an eye-opening thing, and I feel every woman should experience at least once in her life. When you get photographed, like I said, and you choose the pictures of yourself, you probably choose only pictures where a certain flaw that you have created in your head is not visible. But the other person who's been photographing you, who sees a beauty of you as a whole person, as an individual, as your face specifically, will choose a picture where you look your most beautiful, your most best version of yourself, And that's the growth, You do it over a period of time, and you learn to see yourself. You learn to see the beauty of yourself, of, how your face is, or how unique or how beautiful you are. And that, it comes with maturity, I think, and sort of level of experience.
True. Yeah, that's very true. So you rightly pointed out, we do get a lot of people who kind of come from, what mindset they come from, and it is our own sort of experience, exposure, maturity, which helps us decide what we should do. Personally, the biggest issue, you use that as an example, but that's sort of the vast majority of people are unhappy with their noses. So nose does not represent just one part of their body. It occupies a big part of the body. So of the percentage of people unhappy with the nose. So, and I get a lot of that. And because the youngsters, at least in India, are funded by the parents, so they have to first convince the parent, which is a big roadblock. 80% can't convince their parents. Yeah. So the 20% who turn up, either they've got meek parents or their parents who want to get a problem out of the way, and there's only a small percentage who kind of really understand the child, right? And so there's my psychological assessment of the person, that when the problem he is or she is pointing out, is that really a problem? You see, if somebody has a crooked nose, which is obvious, so then there's an obvious problem.
Yeah.
It's not about not being happy about it. Yeah, but if somebody comes and says, oh, my nose flares a bit too much, or when I smile, see this photograph, my selfie shows me this way, or my nostril is showing a bit more, those are the sort of, red flags which I would sort of, very tastefully sort of, side sweep them away. So that's sort of, that's, a fun challenge to kind of say no to. So that's what it is. The other thing is also, as you said, about, a cultural thing as well. Like, for example, prominent ears. Kids get teased in school when they're prominent ears. When I was in Australia, there was a routine. Every school vacation, we had a list full of prominent ears which we had to do. These sort of 5 to 7 year olds whose, ears we were setting back. And then come here, sort of, when somebody's prominent ears, the family will say, oh, you've got Ganesha's ears, so suddenly, which was a disadvantage, is now a lucky charm, right? So that person sort of likes it. So here, the number of people getting set back of the ears for ears which are prominent is very low. So that's sort of, I think it's a healthy way of sort of, avoiding something which is natural. Mm-hmm.
That's very beautiful. In Russia, like I said, I think plastic surgery is very popularized. I don't know about other countries, but because I spend there a lot of time, it's just very popular. So we have a lot of not just celebrities, but people in general, like who are obsessed with their nose. I don't know what is it with nose, but like you said, I think it's number one plastic surgery when it comes to the face, cosmetic procedures. So they make it smaller and smaller and smaller and smaller to the point where it just becomes like a thin line, And there's so many cases like that. That's not a rare thing because it all comes from your head, Sometimes you're just too, how to put it, the insecurities run your head, and I think that's where maybe the ethical line should be drawn. And again, I think in the age of social media where we compare ourselves way too much to others, this is where the need for like, okay, I don't look like others, I need to change myself so that I look more acceptable, desirable like others. You know what I mean?
True. Yeah, sure. So basically, as I said, you got to decide
yeah.
the psyche behind wanting a procedure done. So if you can define a problem, you can solve it. But as I said, if you spend more time and you find out that, he feels that he's rejected because a girl has not accepted him because of the shape of the nose, you may correct and make the best nose possible, but still that girl's not going to accept him. So then they'll shift from, him feeling bad about his nose to now feeling bad about the surgery. So you actually, as a surgeon, you're creating a new problem for yourself. So it is very important, that we kind of weed out such psychological issues, and we should not be quick off doing a surgical procedure just for anybody. So we should really look into the reasons and the merits why they're doing it, especially if it's not a very obvious problem.
So I know that your forte is the breast augmentation. So could you just maybe walk me through, who usually opts for this procedure? What is the recovery time? Are there any downsides to that?
Yeah, well, breast in general is what my forte is, and a significant portion of that is breast augmentation. Breast augmentation, who gets it done? Basically, at least in India, it is different age groups. So I've got this young age group where it's sort of matrimony driven. So you want to have, be at your best to be able to sort of, do well in your relationships or start a relationship or establishing a relationship. And then I've got the other group who sort of lose a lot of breast volume post-pregnancy. So after they've completed their family, they just find that they are no longer the size which they were. So there's sort of a kind of loss of identity in a way, is sort of self-consciousness. So they want to be back to what they were. So they are sort of a very defined group who know what they want to be. So they're the easiest to look after. And then I have the third group who are a more mature lady who after, and this is very common, the day the youngest child goes to college, they come and say, okay, now it's time to look after myself. I always wanted to be a certain size. I was never, now I wish
they've done it before. What a waste.
Yeah, well, so but the thing is, it's also access to time, to funds, to, mindset, so everything else. So that's sort of what, as to the procedure itself, it's a pretty straightforward procedure. There are two ways of augmenting the size of the breast. One is by using an implant. Implant is usually a silicone-based implant. Why silicone? Because it's sort of the most inert material, least reactive material to the human body. So it can stay there within our body and not react. So that's sort of why it is the preferred substance to use. And also it's predictable, so it'll maintain its size over time. So, and we can also, literally I can tell beforehand what it's going to look like. So that predictability is what makes it more, desirable and endearing to women. So that's how we do it. Of late now we also tend to put in a little, so especially for a bulkier lady or someone who's got a bit more extra fat, we would harvest a bit of fat and then also add fat to that to give a bit more volume or shape to what you'd want. So we call it like a composite augmentation. A bit of natural fat and then implant. So that's what it is. And then as to recovery times, it's pretty much a day procedure. Anesthesia is very safe. So people come in the morning, get it done. They're home in the evening. Yeah, and you have a special tape which you put on for a week, and you come back in a week's time, get the tape removed, and then get into the new size bra you want. and that's
So
it.
simple.
So yeah. So but the key is getting it done from an experienced doctor who knows what he or she is doing, has been properly trained, and in a good setup. Because all these things, there are so much things, there are ways things can go wrong, but a proper setup is what's important. Because as having been the president of a society, we come across so many sort of issues with poor quality outcomes. That's because they're untrained people, unqualified people who do it, and that gives the procedure a bad name. So sort of selection of the facility and the doctor is also very important.
Very important, I see. And does it need a replacement, like the implant? Is it supposed to be replaced after
The
certain?
current ones, not really, because obviously technology and nanotechnology has improved so much that it doesn't require a replacement at all. So as with everything, as our body, as you're talking about aging, the more you look after yourself, the longer it's going to sort of serve you. So that's pretty much what
And
it is.
can women breastfeed after surgery?
Oh, absolutely. Because this implant is put behind the breast gland. So it's just sort of just pushing the breast gland forward.
Okay.
So it has got nothing to do with the feeding mechanism.
Nice.
So
Because
yeah,
I think a lot of people think about it that that's
true.
why they do it much later at
Later,
the
correct.
age.
Yeah.
Because, there's a stigma that if I do, then I cannot breastfeed my child.
Yeah,
Apparently,
sure.
you
No,
can.
that is fine. Yes.
Okay. That's
Yeah.
very fascinating.
So yeah, as opposed to that, when you talk about breast reduction surgery, that sort of to me is not cosmetic surgery at all,
Okay.
especially in India, because most women who get a breast reduction done is for functional problems, and that's something which even other women who don't have large breasts can understand, and no way can men understand that, because with heavy breasts you end up with a neck ache, a backache, posture issues, and you can in our sort of humid climate you get sort of sweating and infection under the breast as it rubs on the chest, on the tummy. So all in all, it's not a very happy situation for them. And men believe, or most the thing in society is bigger is better. But it's across the board. Most women who come to me for reduction sort of are so conscious about the fact that they are being looked at or stared at, that they just as one woman said, that she dresses to hide. So basically, your clothing's not right. If you don't wear, fashionable clothing, you don't feel good about yourself. So it's sort of a spiraling cascade downhill,
see.
which sort of then your overall, you put on weight, you don't sort of don't look after yourself. So just a small procedure, which is reducing the size of a breast to something which matches your physique, and you get a new person, and they are my happiest patients. And on an average, to give you an idea, an average, if I see over my last 25 years with so many procedures done, the average weight I remove is anything between 700 to 1.5 kilos per breast. So
What a
totally meaning,
relief for that
So
person.
meaning means like 1.5 kilos to 3 kilos overall. So what a posture relief.
Wow.
So that's sort of something which women themselves don't know, or the ones who get it done still do not tend to tell others what they've got done. So this awareness is pretty less so about that. They think something that would diet, and dieting is not going to make a difference.
Phenomenal difference. Interesting.
So as opposed to that, when I was in Australia, there it was very open, and they would actually have had a few ladies there. It was also reported in the newspapers, because the trend that time that they would have bra burning parties after having done that, because they were so happy. They were ready to celebrate a new life. So
I wish we had this kind of attitude here.
yeah, I think it'll get there.
It'll get there, yeah.
Yeah.
But I think men in India, I think they're more upfront about it. Men also get plastic surgeries done. Of course, they get cosmetic surgeries done. That's a very normal thing. Usually body composition, right? And in my experience, they're more like upfront about it. They're more unapologetic, because it's just how it is, societal pressure on women versus men. So what kind of procedures men usually get? And So yeah, just what kind
Yeah,
of
sure.
procedures?
See, for men, basically, the most popular two procedures that I do, number one is a hair transplant. And it's an obvious problem. And, when I started my career, it used to be like, the youngest we did was 27, 28, whatever. But now, hair fall and hair loss has become such a rampant problem.
And India's obsession with hair. Sorry, Rafi, but India, there's just obsession with hair. And the
That is,
more, the better. You know, they
yeah.
think, oh, if I don't have hair, like
Yeah, that is very
that's
true.
there.
So yeah, so as a plastic surgeon, that's a boom because
You are very happy with
every
that.
second person is
Yeah,
my
you see
potential client.
the Bollywood actors. You know, in the movie, it's always the hero with like
Yeah,
a big,
the big hair. That's correct. That's
lion
correct.
mane.
Yeah. So that's sort of the biggest thing. And the other thing now, which is much more common, is man boobs or gynecomastia. So and that's is an issue which fit men because in spite of having a good physique, their breast is almost double or triple what it should be. So and that's again not going to go away with diet or exercise. So it requires a surgical
Also,
removal.
hormones, I guess, lack
Exactly.
of testosterone.
Yeah,
Probably,
absolutely.
and-
No, I mean, there's still sort of the verdict is still not out on that, but I believe it's more got to do with the hormones in our food chain.
Okay.
You see, and that's where I think government needs to get in for the health of society. See, there's so much more milk production. So there's so much of hormones given to our cows and buffaloes to get milk. Now that's bound to come into the food chain, right? And that's bound to. That's why I get young girls now with such bigger developed breasts, and boys as well. So why is that? So that is a society problem, and it's not only. I mean, we are just sort of one end of the spectrum trying to correct those ones who can afford it and who are aware of it and who are feeling disadvantaged. We look after. But there's a big wider population who's still living with it. There was this boy who, again, he was a sportsman, and his mother noticed that whenever they had to travel outside for tournaments, he would not go, and whenever they were playing locally, he would gladly play, and he was a good player in the team. And so sort of getting into it, she found out that he was just very embarrassed to take his T-shirt off. Because whenever you go, you travel as a team, you kind of live in dorms and, you got shared facilities. So then finally he got his procedure done, and then that's when he started, got ahead in his sports career. So sort of these are society issues which have to be addressed. So
plastic surgery, I mean, often it's a cure sometimes, for your confidence and self-consciousness. And I think if it's a conscious choice and it's justified, I think it's amazing, in any way. And also what I wanted to say is that, I think a lot of people are not very honest about it, but pretty privilege is real. Am I right? It is real. You get more advantages, not just like in your matrimonial, like you can marry someone, that you desire, but also in the workspace. You could sometimes people get promoted just for their looks.
True.
You can have the same education, the same level of experience, but because you look better, you're more presentable, the chances of you getting a promotion are much higher.
True.
And everybody knows this, but chooses to ignore because we were taught that this is superficial. Which is just not the case. It's just a part of your life. Looks is a part of your life, and we need to acknowledge that. Better looking people, get ahead in life a little faster. It's just
very true. But see, I would see it a bit more holistically. See,
exactly,
whatever
yes.
you are endowed with or gifted with or born with, you got to optimize your resources. Now, you are talking about something which is quantifiable by anybody, which is looks, right? So if you're good looks, you're ahead. Same way, what about the mind, the IQ? See, you can only train yourself so much. A lot of it is inherent IQ. So the one who's brighter, if he optimizes his potential, he's going to get ahead much easier than others. So, so you don't sort of tell him, why are you brighter than me? You see? So it's optimizing yourself. So that's absolutely fine. I mean, there will always be naysayers with everything.
Yes,
but yeah.
yes. And we all have our strong sides to us.
True.
Everybody's gifted in something, I truly believe. Actually, another thing that I genuinely believe is that everyone is born beautiful. everyone. You look at
True.
any baby, beautiful. I've never seen a bad-looking baby. They all are beautiful. The innocence, the eyes, everybody's beautiful. Even, babies who are born, let's say, disabled. You still look at them and you're like, wow, it's so beautiful.
Gorgeous,
That's there. But then something happens, I think, to us through the life. We get programmed, you're this, you're that, and you start believing that. And that kind of belief system forms also how you look and how you present yourself.
True.
And that's where we sort of, from being beautiful as we are, we turn into like, okay, I'm okay, I'm not as beautiful, that's where, I wouldn't say ugliness comes, but you know what I mean, that just comes from the mind. That's the point that I would love to bring, but otherwise we all are born beautiful.
I totally agree with you, spot on. And thing is that even if you are disadvantaged, there's always ways of you getting ahead. Yeah. Recently there was this thing about a girl living in the slums in Mumbai, and she was on the cover of Cosmopolitan and Vogue. So that was pretty amazing.
I follow her on Instagram.
She's stunning. Absolutely. So you can, you got to optimize yourself, and you got to look at chances of getting ahead. So yeah.
It's all about being the best version of yourself.
Absolutely.
I think that journey is beautiful.
True. Well, that's what the depth of life is, So optimizing, that's what you said.
Yeah. Okay, great. Yeah, but again, I think in India, we have sort of normalized, like IV drips for brightness, for brightening skin. We have all these fairness creams. Okay, not fair, now it's brightening. Okay, we can't say fair creams. It's brightening, okay?
Yeah.
And then, of course, we have also procedures for the face, like, be it laser, IPL. So these are all normal things to do. You won't get judged for that,
Correct.
But the moment you choose, like, okay, I want to slightly, maybe do a facelift, or I want to, get a nose job, rhinoplasty. Now, that is sort of looked down, and I love that the shift is happening. So what do you see that maybe with the Gen Z, how they approach plastic surgery and how they see it? Is there any change in that?
Oh yeah, there's an sort of amazing change in how they look at it, both for the positive and the negative. I'll dwell on that. But yes, your first point about women being judged when they get procedure done, surgical procedure done, as opposed to something more superficial, is definitely there. I think that's got to do with a few things. Number one is our upbringing, especially in India, where it's sort of all looking inwards. Everything what you do, you have to be natural. So, God gave you this gift, and so it's sort of everything is explained. So that's why, so many times the woman herself has a problem and she's not willing to acknowledge it. Right? So she'll not come forward to looking for a solution. So, and that's what the baseline for our society has been. So that's sort of changing now. But then also that's what the mindset for the man is there. And women, mothers don't tend to sort of, inform, educate the men in the society. So that as long as that disconnect is there, men are never going to understand. It's not that they're not understanding, they're not being told and taught. A lot of things, because we were just two boys, we males, we did not understand what a woman goes through. So it's only being a doctor that you understood it. So which is now changing a lot, because a lot of education's out there. That's why I think social media has changed. Gen Z is very different. So now they're looked upon much differently. So that's good. And the bad part is, with the Gen Z, there's a lot of immaturity. So as you initially said, your frontal cortex is not developed, but you think you know everything because you've read it or heard it or whatever. So they're given to immature decisions as well. So it's sort of there's always two sides to a coin.
Yeah, but the progressive impact, I think, with Gen Z, they just care less. Like, opposed to my generation, I feel that they care less about what society thinks. They're more about what I think is important.
Yeah, that's true.
That's a good shift. That's not
that's
bad.
a good shift, yeah. So I think in India, they're still held back because we are sort of in a flux. So we are part progressive, part held back. And that's because our Gen Z still wants to live with the parents, take money from the parents, and, not be financially independent, but they want to be emotionally and mentally independent, So that's why they're held back, because the money comes from the parents. So they have to actually, involve them. So that's where The difference with the West is as I see it. But I suppose that's changed as well.
That's there. And also, I think when it comes to plastic surgery with the younger generation, like a lot comes from insecurity in social media, not just in India. I'm talking about, I think, worldwide, overall, social media plays a huge role. Like, again, to give an example, if we all have seen the Kylie Jenner transformation, she got her first surgery, I think, when she was just 18.
18, correct.
And there were a lot of procedures. And now she slowly has come down to a more natural look,
Right.
So again, it's not like, it wasn't exactly a surgeon's vision. It's that when she was 18, she had a certain vision for herself, for the media and for the glamour, and maybe it did work because at the end it generated her a lot of fame and money, actually, if you look at that. And now she has come to a more like sophisticated natural look, while removing some sort of implants, reducing the fillers, and etc., etc. But I think the downside of like going overboard sometimes with fillers, which a lot of women probably don't understand, it of course depends on your aging type. For example, for someone like me with my aging type, is that it's going to be probably sagging skin, like with Caucasians, especially with Russians. That's how we age usually.
Right.
It's not even about wrinkles, it's about the sagging skin. So you basically are losing volume, in your face. So what happens is that if you inject more fillers, and you can correct me if I'm wrong, if you inject more fillers, and then it's a thing that you will have to probably redo and again, especially if it's the hyaluronic,
Yeah.
right? So your skin loses more and more and more volume, right? So we all have seen these photos of celebrities taken in a bad light on a red carpet.
Correct.
And we're like, oh my God, she looks so old. Why does that happen, So I think that is probably the reason, with first of all not understanding either, your type of aging, and being not very mindful about the kind of injectables we get, because fillers are not just for aging, they're mostly about reshaping your face. So be it your cheekbones or your jawline, so these are very common placements, or even your lip fillers. So what happens naturally, gravity does its thing, so this starts sagging and then you get these lines as
Right.
well. People saying, oh, I just got it done, it will disappear within 6 months. I'll do it again. It's not that serious, But they don't look at it as a bigger picture. This is what actually happens with your face, especially with that type of aging.
True. Yeah. It all comes down to choosing the right, counselor you want. Because as you rightly said, that aging is a defined and definitive process, which you cannot and should not deny. It's just that you want to make it as subtle as possible and sort of do timely corrections or timely care, which might slow it down or not sort of have an untoward effect. So going over the top with anything is not going to help, and especially with fillers. I'm glad you mentioned that. Is that the filler? The word means filling up a hollow, but as a sort of pun, I would also say it's filling the gap between nothing and the right thing.
Okay.
Right. So if the right thing is to kind of get a facelift, and then somebody comes up and says that, oh, listen, you'll avoid a facelift, just do this and you'll be fine. So, you buy into that, whether it's marketing, trust, whatever it may be, and you get it done. And now you find that, no, you're not yourself and you're not what you want it to be. So now I'm here.
Not
What do I
here,
do?
not there.
I have to put a little bit more, right? So that sort of is what I think what gets people stuck into. So it's sort of, your desire to get, I call that the mandir principle. You go and pray and hope everything gets right. It doesn't happen like that, right? So the reality check and going to the right person and knowing exactly, and your expectations also should be grounded, and that's what
Yes.
helps you kind
I
of.
think sometimes people are just so scared of any invasive procedures. So they would think, oh, if it's just an injection, I would rather do that than a facelift. But it's not necessarily the best thing. And of course, you are a surgeon, like you would understand that.
That's true. So a responsible counselor would actually sort of really know on certain terms explain, that what you expect is not really going to happen. So either live with what you have or sort of get the procedure done, but don't expect something which is not possible with that. But then in today's marketing world and today's so-called competition, so all things. In the past, I remember when I said no, it was a no, and people would just go back. Now, when I say no, they just go next door and just get it done. So,
Yeah.
yeah. So,
Of course. Especially at the
So,
clinics, I think, who only perform Botox and injectables, the cosmetic procedures, basically.
correct, yeah,
They don't do facelifts.
yeah,
So, of course, they would advise, okay, why do you need a facelift? It's just like
precisely.
half an hour and you're done,
Precisely.
Done.
Yeah, yeah.
And it's
Yeah.
cheaper and there's no
Cheaper and their
downtime.
offers and
The offers.
so all those things. So for a medical facility, giving an offer sounds very
Yeah.
sort of
And usually, okay,
yeah.
it looks good when you just get it done. There are some cases when it looks good, but I think there is also, like, what I have noticed is the water retention. It's very visible on some faces. Like,
No, see, no,
me
don't get
and
me wrong. In the right person,
the
doing the
right
right
person,
amount, right,
yes.
it is wonderful.
Yes.
It is transformative, So, and, it's really an art. Using Botox and fillers and certain injectables, it really
It's an
can do
art,
wonders,
yeah.
but it has to be, the end should be defined and it should be done at the right time.
And the right candidates.
Exactly, exactly.
Okay, so speaking of beauty industry, beauty industry is booming with anti-aging products and supplements as well. So you would see a lot of creams, like let's say with collagen, that you would apply it, on your skin and magically firms that. I don't know how it works. Please tell me more about that. What's your
Well,
outlook?
see, you got to understand that the skin, nature gave us skin as a barrier to prevent assault from outside, right? I mean, I don't go swimming for an hour and I get bloated because the water's gone into my body, right? So same way, if you just apply something, doesn't necessarily, it will not go in to your body. So if you're applying a nutrient on the skin, it's not going to go in. It's probably going to go into, the outer layers of your skin. It might exfoliate. It might, sort of stick to the surface and give a sense of glow or hydration. So that's the upper layers. It cannot go way beyond the way it is made out to be. So there has to be a vehicular mechanism to get it into and across the skin barrier. So that's sort of, it's a lot of marketing.
A lot of marketing. I completely
And
agree.
it's $1 billion marketing industry. So
I see. Actually, similarly, I want to know your opinion on this. I think since 2020, there was a boom in clean beauty products. So clean beauty are basically, skincare products that don't contain certain toxins like, be it silicones, parabens, sulfates, etc. And while I think it's a great movement which leads to more conscious sort of formulations, we're more mindful, which we should be, But the whole thesis of clean beauty is based on whatever you apply on your skin goes directly into your bloodstream. Now, I have my doubts on that, and I want you to maybe clarify on that. Is that true? Whatever you apply on your skin goes in your bloodstream?
no way can that be true. And science will bear out on that. And see, yes, anything applied repetitively is going to create a repetitive damage, and it's going to percolate through, but not the way it is made out to be, that you just apply and you're fine. Not really on that. Yeah, you're much better if you want. You take sort of nutrients orally to kind of help you along, because that is overall going to increase its blood levels. That's where you get nutrition across the body, across all areas of your skin, and that makes a difference. So that's sort of what we have to look at.
And when we talk about the beauty supplements, I also feel a lot of that is marketing. There must be some very good supplements, I'm sure. But I think when it's being marketed as you take it and goes directly into your skin or directly into your, hair, obviously we understand it does not exactly work like that. Your body takes it and decides, where to use it, let's say. So are there any supplements that you usually advise to your patients based on their requirements, or there are any supplements that you think that's just marketing?
Yeah, well, a lot of, as you said, there's a huge industry. So whenever there's a huge industry, there's going to be all kind of spectrum for the most ethical and the best to absolute shams. But yes, as a doctor, I still look upon as vitamins, and again, my body will only take in vitamins which are deficient. So if I'm topped up on something, I don't need to take them, because that can lead to toxicity. So you need vitamins, there are certain minerals which you require, and we can again dwell on each of them as a separate topic. And in addition, I'm sort of more into holistic health. I just don't believe that allopathy is the answer to everything. You got to look at Ayurveda, you got to look at nutrition extracts, plant extracts, which make a difference, and those also make a difference. So you got to look at what your issue is, and based upon that make a choice. There is nothing like just a magic pill that only which will do. Yes, there are certain things which boost your immunity. There are certain things which are good for your hair. Certain things which are good for overall detoxification, and that makes a difference.
Okay, I see. Very interesting. So we always talk to a doctor, okay? We don't just take things. Yeah, of course. I mean, that's something I feel like people should have more awareness, of course, when it comes to vitamins and deficiencies. The blood tests are very important. If you could say one thing to women who are considering plastic surgery but feel ashamed or judged, what would it be?
I would basically say that if you're clear that you have a problem which plastic surgery can fix, do not hesitate. Choose an experienced doctor and a good setup and go ahead.
Amazing. Actually, the good thing about India, besides having very qualified doctors, is the cost of it. If somebody is considering getting a certain procedure done, be it a hair transplant or maybe a plastic surgery, why would a person from US would consider, let's say, going to India instead of Turkey?
Yeah, well, that's a good question because of late Turkey's become the go-to place for hair transplant. Well, specifically for hair transplant, I can tell you that I visited Turkey a couple of years ago, and very few plastic surgeons are doing hair transplant. So it's basically technicians who do hair transplants over there, and it's quite an unregulated industry, and it's sad, and because it will eventually give the procedure a bad name. It's helped with their marketing stuff, but overall, whenever I talk to people, I know many of people known to me have gone there, and they tell me only after they've got the procedure done. And when I ask them the name of the doctor or the qualification, they don't know at all. So, which is sad because that's not the way it should be. Everything when it goes right is okay, but if there's a problem, then you are in difficulty. So for that reason, at least in India, you know who you're getting into. You should check and get it done from a plastic surgeon so that you know the credentials are right, you know the training is right, you know his ability to handle problems. Any surgical procedure can have problems. So you need to have somebody who looks after you well. So that's sort of my take on sort of the risks for Turkey.
Amazing, amazing. Thank you so much, Dr. Sandeep Sharma, for all your insights. It was a pleasure talking to you. And if you have enjoyed watching this episode, please like, share, subscribe, and let us know your thoughts in the comments. Thank you. Bye.